Have you ever wondered if there's a connection between trauma, addiction, and memory loss? This question, intriguing as it is, seems to be on the minds of many, yet the answer isn't as straightforward as one might think. We live in a world where trauma and addiction are unfortunately quite prevalent. In every corner of the globe, people are grappling with these issues, often in silence. And memory loss? That's a phenomenon that's largely misunderstood. It's not uncommon for individuals who've experienced trauma or struggled with addiction to also report instances of memory loss. Could these three elements be interlinked in some way? At first glance, they may seem like separate issues, but what if they're more connected than we realize? As we delve deeper into this subject, we'll explore these connections, aiming to shed light on this complex and captivating intersection. Now, we dive into this fascinating connection, making it easier for you to understand. It's time to unravel the link between trauma, addiction, and memory loss. Imagine walking through a dense forest with only a flashlight to guide you. The trees represent the various challenges and experiences we face in life. A traumatic event is like a towering, ominous tree that blocks the path, casting a large, intimidating shadow. To bypass this obstacle, some individuals might resort to using a coping mechanism akin to carving a new path around the tree. This coping mechanism can sometimes take the form of addiction. Addiction, in our forest analogy, is like an aggressive vine. It initially seems like a quick and easy route around the traumatic tree. However, once you start using it, the vine grows rapidly, entangling you and making it harder to escape. This is because addictive substances or behaviors can change the brain's structure and function. They stimulate the brain's reward system, releasing a flood of dopamine, a neurotransmitter that signals pleasure and reward. This flood of dopamine is much higher than what our brain is used to handling, leading the brain to adapt and reduce its dopamine production over time. As a result, the addicted individual needs to consume more of the substance or engage in the behavior more frequently to achieve the same level of pleasure, setting off a vicious cycle of addiction. Now, let's consider memory loss. In our analogy, memory loss is like the fog that descends on the forest path. The more entangled you become in the vines of addiction, the denser the fog becomes. This is because chronic substance abuse can damage the brain areas responsible for memory, such as the hippocampus. This damage can lead to difficulties in forming new memories, recall of old memories, and the ability to focus or pay attention. Moreover, stress hormones released during traumatic events can also impair memory function. This fog of memory loss, combined with the entangling vines of addiction, can make it increasingly difficult to find your way out of the forest, back to the path of well-being. So, we see how a traumatic event could set off a chain reaction, leading to addiction and potentially memory loss. Now that we've explored this link, what are the key points to remember? Firstly, we delved into the connection between trauma and addiction. We learned that trauma, especially in early life, can lead to a higher risk of substance abuse and addiction later on. This is because the brain may use substances as a coping mechanism, a way to numb the pain brought on by traumatic experiences. Secondly, we explored the impact addiction has on the brain. Addiction, as we discovered, can cause changes in the brain's structure and function. This is mainly seen in areas related to reward, stress, and self-control. The brain, in its quest for the addictive substance, overrides other healthy impulses, causing a detrimental spiral that is hard to break free from. Lastly, we discussed the potential for memory loss. The constant cycle of trauma and addiction can lead to significant memory loss. The brain's reward system becomes so focused on the addictive substance that it neglects other important functions, such as memory processing. This can lead to gaps in memory, difficulty recalling past events, and even trouble forming new memories. In conclusion, the intersection of trauma, addiction, and memory loss is a complex, intertwined relationship. Each aspect feeds into and impacts the other, creating a cycle that can be difficult to break free from. Remember these points next time you think about trauma, addiction, and memory loss and their intricate relationship. We've unraveled a complex link today. This journey through the intricate connections between trauma, addiction, and memory loss has been enlightening. Your time and attention are greatly appreciated. It's essential that we continue these conversations, reflect on the implications, and strive to better understand the human mind and its experiences. Thank you for joining us in this exploration. If you found this video informative, do hit the like button and subscribe for more such content. Until next time, keep learning, keep